My name is Alice Goodman. I'm a nurse practitioner, and this is Denise. Today we're going to be injecting Denise for TMJ. She clenches her jaw, so we're going to be injecting these muscles back here to help relax that muscle so that she doesn't clench her jaw as tightly. A little bit about me, my background. I have been working in the aesthetic field for about 12 years, and I've been injecting Botox and fillers for about that length of time, about 12 years. Denise, would you like to tell them a little bit about your experience?
I had this 6 months ago for the first time. I didn't know that there was anything that could be done for TMJ other than a splint or a night guard. I had surgery years ago for TMJ. This is amazing. It just, you wake up headache free, your face is no longer sore, your jaw doesn't feel any different. That's hard to explain. You eat the same, everything feels the same, but you just don't clench. So you're pain free. It's hard to explain unless you have the problem. If you have the problem, you know what I'm talking about. It is so simple, and I wish it had been around or known to me years ago. I believe this would have prevented surgery. So it takes very few units. How many units, Alice?
Actually, it takes about 50 units. The recommended dosage from people that do it is between 40 and 50 units,
okay,
split into equal doses on each side.
So 25 on each side, correct, and it'll last me for 6 months. So we're looking at 100 units a year to keep you pain-free. It's just amazing.
So the first thing I'm going to do is I'm just going to clean the area with a little bit of alcohol. And I'm going to have Denise clench her jaw. And when she clenches, I can actually feel the muscle. So I just mark the borders of it so that I am injecting into the muscle that I want to. And I use a very small needle, and you can inject one big bolus or a few small boluses. I prefer to use a few small shots because I feel that she gets a little bit better coverage with it. And we have one side done.
So I use no numbing cream, there's no nothing, and because the needle is so fine, you don't even feel it. This is not like going to the dentist. This is not like, there's no pain involved.
It's a very quick, fairly simple procedure. And there we have it.
So, well then, this seems to work quicker. About how long before I should have results?
The average length of time when treated with Botox is 3 to 4 days before you just begin to see the results. Sometimes when you have a big bolus into an area like that, you can see results quicker.
Yay.
So hopefully within 24 to 48 hours, Denise will start to get some relief with her jaw clenching.